This is Todd Neal with MedPage Today. Researchers in Wisconsin used data collected over the course of the past few flu seasons for vaccine efficacy studies to directly compare the disease characteristics of the pandemic H1N1 virus with those of seasonal influenza A strains. Dr. Edward Belongia of the Marshfield Clinic Research Foundation explained.
We realized that we had a unique opportunity to do a comparison between people who had developed the pandemic H1N1 infection versus people that had developed other strains of influenza A during earlier seasons.
Patients who reported fever, chills, or cough during the 2007 to 2008 and 2008 to 2009 flu seasons or during the pandemic were included in the study. All were tested for influenza A, asked about their symptoms, and followed for clinical outcomes.
We really saw very few differences when we compared the symptoms of illness and the risk of complications in people that had the pandemic H1N1 infection versus those that had seasonal strains of influenza A. In terms of pneumonia and hospitalizations, we didn't see any difference in children when we compared the pandemic H1N1 infection with children that had other types of influenza A. They had similar risk of being hospitalized and similar risk of developing pneumonia.
The risk of hospitalization didn't differ between the three strains for adults either, but pneumonia was more frequent among those infected with the pandemic strain than among those infected with H3N2. For MedPage Today, I'm Todd Neal.